Hello, everybody, and welcome to ICMDA webinars. I'm Dr. Peter Saunders, the Chief Executive of the International Christian Medical and Dental Association, and that brings together about 60,000 Christian doctors and dentists from around the world from over 100 affiliated national movements. And today on ICMDA webinars, we have Dr. Alex Bolek back on healthcare amid civil wars and conflicts. So it's just such a pleasure to have my dear brother, Dr. Alex Bolek, back again. The subject he's addressing today, I can't think of anyone more qualified to do it through his experience. But the healthcare system and its service delivery are one of the vital systems in any given country, and the interruption of it is disastrous. The healthcare system's got 7 pillars altogether. So there's human resources for health, health financing, access to medicines and medical supplies, leadership and management, health infrastructure, coordination with health partners, and health information systems. And civil wars and conflict affect all of these pillars, as we're going to hear in much more detail, and therefore the whole healthcare system in a country. In this webinar, Alex will describe the impact of civil wars and conflict on the healthcare system, consequences of related service delivery interruption, and some strategies to continue providing healthcare services amid civil wars and conflict. So Dr. Alex Bolek studied medicine at the University of Oradea in Romania and has a master's in public and tropical health. He's also worked as a GP and medical director in Khartoum, Sudan, and also for JHPIEGO and other international NGOs. He's the chairman of the CMDA, ICMDA's member organization in South Sudan, and he's also the ICMDA regional coordinator for the whole region of sub-Saharan Africa, and was previously the East Africa regional secretary. He's married to Helen, and together, as well as running a school, they help care for 14 nephews and nieces. So, Alex, we don't know how you have time to prepare for seminars like this, but we're really grateful, and we really look forward to hearing from you and also interacting with you after your presentation. So over to you, brother. Thank you so much.
Thank you so much, Dr. Peter, for the kind good introduction, and nice indeed to be back in ICMDA webinars. So here we are, as Dr. Peter just mentioned, we this afternoon or this morning or this evening, wherever you are, we are sharing today about healthcare amid civil wars and conflicts. And for those of you in ICMD who have known my story, I've grown up in difficult times of conflict, and even right now I serve in circumstances of civil wars and conflict here in South Sudan. If you look at the map of the world today, this is one of the examples from Africa. You see countries, many countries which are in conflict: Sudan, DRC Congo, previously Ethiopia and the Oromo region, Eritrea, Niger, Mali, and even Yemen. And if we bring the world map before us, you can see also, you can see Gaza, you can see Ukraine, and many other countries that are in conflict. And so war and conflict, war is a conflict carried out by force of arms as between nations or between parties within a nation, which is a civil war. Warfare as by land or sea or by air. So that is war and conflict. And war is a state of or period of armed hostility or active military operations. Just want to share in the beginning that back in 2013, we had crisis here in South Sudan, and I happened to be working for JAPIGO organization as part of Johns Hopkins University. They had a program here in South Sudan, and I was the HIV technical advisor for that program. And during the crisis in 2013, I remained behind. I remember that time the problem started over a weekend. Some of my colleagues were in Uganda, in other parts of Africa, of East Africa, and the country director was not in country. So I remained behind alone, and I decided that our program should not be interrupted. Our patients should continue to be served in that conflict and in that time of crisis. So after the crisis, my colleague from headquarters in Baltimore wrote my story, and the story that you see before me before us is a story that Japaigo wrote about the service that I provided during that time. And after that crisis, the president and chief executive of Japaigo in Baltimore wrote to me a personal letter just to thank me for standing in for the organization, because the organization in that difficult time continued to provide services through me and few facility-based staff. And she decided to write to me this letter that we see. Of course, I never expected any story to be written about me or any letter to be written to me to thank me. I was just doing a service to humanity. So I was surprised that Japaigo decided to write a story, and my boss in Baltimore decided to write to me this personal letter. So just to let you know that I served during such times and such difficult times. Of course, some of you know my story. I was born and live and currently living in circumstances of civil war. We had 17 years of civil war from 1955 to 1972. Those are 17 years. Then I grew up during the second civil war that spanned 22 years from 1983 to 2005. And as I just mentioned, in 2013, we had a crisis here in South Sudan post-independence from the north. This continued from 2013 to date. So all of my life I've been in difficult times of crisis from the time I was born to this moment. So let's now turn to our topic of today. Healthcare is the organized provision of medical care to individuals and communities. So that is the definition of WHO. And the healthcare service delivery includes disease prevention, diagnosis, treatment, amelioration or cure of diseases, illnesses, injury, and other physical ailments and impairments. Now, healthcare amid civil wars and conflicts therefore refers to provision of medical services, resources, and support to affected populations despite the disruptions caused by violence, instability, and the breakdown of the health care system or infrastructure. So, and this is what we are talking about, that in spite of civil wars, in spite of the destruction, we try to continue providing those services needed by people, because in such times people are in their need of those services. And Dr. Peter mentioned in his introduction that the healthcare system is built on 7 blocks or 7 pillars. The first block or the first pillar is human resource for health. These are doctors, pharmacists, nurses, midwives, lab technicians, community healthcare workers, pharmacists, all of them are the human resource for health. And then the second one is health financing, because without money, the healthcare system can't run efficiently and effectively. So health budget is always needed by governments, by institutions to be able to provide health services. And this can come from either government or insurance companies or donor aid or private payments, or sometimes out-of-pocket payments to the health system. And then access to medicines and medical supplies, which is quite another vital pillar of the health system. And then leadership and management. Of course, when we see the health system running efficiently, we know that there are good leaders up there, maybe up there in the Ministry of Health, and in health facilities, no good managers leading them. So leadership is key as well, and one of the 7 pillars of the healthcare system. And then, of course, health infrastructure, buildings, hospitals, health facilities, including bridges. Even bridges are important because once a bridge is broken, people can't cross and people can't rush with a sick person to hospital, as I will show you in some of the pictures. And then, of course, coordination with health partners like unilateral and NGOs, unilateral organizations like WHO, UNICEF, and other organizations. And then health information systems, which is important for monitoring and evaluation, data collection, and surveillance. So those are the 7 pillars. Now, how do wars and conflict affect these 7 pillars? The first thing is the first effect is on human resource for health. In times of crisis, human resources are killed. They also migrate. So we lose experienced personnel, and there's reduced morale to do the work, and there will be no productivity in the work. So whenever there's civil wars, these people you see in your right-hand side, these people fleeing from civil wars, some of them are doctors. And I have gone around in some of these countries. I found doctors who are here in South Sudan, who are in Sudan. They are now in neighboring countries. They left the country because of the civil war. And one of the doctors, urologists in Aleppo Hospital said, you must be first saved to be able to save others. If you kill the physicians or destroy the hospital, the medicine doesn't benefit any people. So the first effect of civil wars is on the human resources. The second one is on health financing. Government budgets are diverted to military spending, and collapse of insurance and out-of-pocket systems, and then withdrawal or reduction of international aid. We have seen some donor organizations leaving the country just because there is a conflict. And this is one example of South Sudan. The Arusha Declaration said that African governments should at least allocate 15% of their national budget for health. But look at this, for 2023-2024 budget in South Sudan, only just between 0.8 and 2.1% was allocated to health, a very, very small budget. And thirdly, access to medicines is affected during civil wars because of lack of financing for procurement of storage, for procurement of drugs and storage and distribution, and insecurity on roads. We easily import drugs. If I take South Sudan as an example, if roads are interrupted, we are a landlocked country, for example. So if the roads leading to neighboring countries like Uganda are blocked for any reason, then drugs may not come in, and supply of drugs may run out in health facilities. And then supply chains is also disrupted or destroyed, and also hospitals get looted, and the medicines are taken by people fighting. And then increased risk of counterfeit or expired drugs. This again and again happens in many countries. For leadership and management, leaders also migrate and they leave the country because of insecurity, and health budget as well is cut. So what can a leader do without any money in his hand to implement the service delivery package. So leadership vacuum is left behind because the leaders leave, and those who are around, they don't have the money to be able to provide services. Health infrastructure is also destroyed. The bridge on your right-hand side is one of the bridges that were destroyed during the Russian-Ukrainian war in 2022. So destruction to health facilities happens, destruction to bridges also happens, and poor road infrastructure because there's no developmental budget to fix the roads, and then disruption to water and electricity supply, and of course inaccessibility. So the health infrastructure is also affected whenever there are conflicts and civil wars. You can see this is one of the roads. And I remember we were traveling to the field, and a vehicle was immersed in water. So you see all of this, and this is one example of a hospital that was destroyed in Syria. In the Syrian war, this hospital was completely destroyed and vandalized. And this is the MSF-supported Ma'arat al-Numan Hospital in Idlib, in northern Syria. It is completely demolished during the civil war. And in Khartoum, there was a report that 90% of hospitals and health centers in Khartoum are all destroyed, and this is one of them. And the only mycetoma research center in Khartoum, that is the only one in the world, by the way. And this center was also destroyed during the fighting in Khartoum. But also, not only health facilities are destroyed, even places of worship are also destroyed. These are two churches in Khartoum that were destroyed during the civil war. I remember back in 2013, we visited four state hospitals because we had the ICMDA National Institute of Health that was started here in South Sudan, was running in this hospital. And during the crisis, this hospital was vandalized. We visited in January 2014, and we found the hospital in a bad shape. For coordination with health partners, this is also affected. Some health organizations stop or they pause their work and quit. Funding to some activities also stopped, and the staff travel to the field as well stopped. So we can see that war is not a good thing. It destroys everything. Finally, the health information systems are also affected. Monitoring and evaluation, data collection, surveillance are all affected. Then, of course, disruption in data collection and reporting, because data is important for decision making. So whenever there's no data collection from facilities, we don't know prevalence of diseases and what the issues are. And then lack of accurate health data for planning and response. So there are other broader impacts of wars and conflicts. This is one scripture in the book of Hosea, that the roar of battle will rise against your people, so that your fortresses, your infrastructure will be devastated, as the in which Beth Arbel and Salman, they destroyed your infrastructure, and mothers and children were dashed to the ground. This is exactly what happens. You find innocent civilians, women and children, they are dashed to the ground by fighting parties. And then, so these are some of the pictures from the war in Khartoum. You see here, there was a report that 9 million children suffered from severe malnutrition, and a child dies every 2 hours from malnutrition and disease. This is a picture taken during the 1983-2005 war here in Sudan, and this was the Pulitzer Award picture for that war. You can see the vulture is ready to eat with the child. In Sudan, in the recent civil war, just in less than 2 years, over 150,000 people, civilians, were killed, and 45,000 children died from malnutrition and diseases. The other thing is insecurity and citizen displacement to live as IDPs and refugees. So whenever there's civil war, citizens get displaced. There was an incident in Jerusalem where one person was killed, and because of the fear of the Babylonians who were coming to attack the city, the Bible says, at this, all the people from the least to the greatest, together with the army officers, fled to Egypt for fear of the Babylonians. So when people are displaced, people go into forest, into places that they would not live in, and they can easily die of disease. I was reading one newspaper in Khartoum about the war in Darfur, and one line was saying WHO has confirmed that 80% of people who died in Darfur did not die of gunshot, but they died from diseases. And this is exactly what happens when citizens are displaced. And during the crisis between King David and his son Absalom, the Bible says the battle spread all over the whole country, and the forest claimed more lives than that day than the sword. So meaning that people who died from forest, people who died from disease were more than those who died from gunshot. Another thing that happens is so here this is just from the Africa Conflict and Conflict Center, Africa Center for Strategic Studies. It just put together all the countries who are in war, that are in war in Africa, and over 40,000 people have been displaced because of that. And you can see the biggest number is from Sudan, and the second one from South Sudan, and the second one is DRC, and plus countries like Somalia. So displacement is a disaster. Thirdly, peaceful movement of citizens, goods, and medical supplies is also hampered. In those days, the Bible says, when there was crisis again in Israel, there was no safe travel between one city and another, because one nation was being crushed by another and one city by another. And so we can see movement of goods, citizens, and medical supplies is affected during civil wars. And this actually leads to shortages of drugs and medical supplies in the country. Another broader impact is the reduction in life expectancy. This is a report from the war in Syria that life expectancy has dropped from 70 years in 2010 to 55 years in 2015. So, the book of Zechariah reports that when there is peace, people live longer. And says, once again, men and women of ripe old age will sit in the streets of Jerusalem, each with his cane in hand because of his age. The city street will be filled by boys and girls playing football. So in time of peace, people live longer, but we also see even sports activities and how joyful young people are playing. The playgrounds are full of young people when there is peace. And then another broader impact is effect on the health indicators. They are sensitive health indicators, and if you look at them, you can tell whether the health system in this country is a good health system. Like indicators like under 5 mortality rate, infant mortality rate, maternal mortality rate. All of those are sensitive indicators that can tell you how good a healthcare system in a country is. But in civil wars, this is one example from South Sudan. In civil wars, these health, uh, these health indicators are affected. You can see here under 5 mortality, in every 1,000 live births, 99 of them die. And in every 1,000 live births, 73 infants die. And for every 100,000 live births, over 1,000 women die. So you can see all of this is because of civil war. Finally, another broader impact is the public health crisis. Outbreaks of infectious diseases due to poor sanitation, lack of immunization, crowding in refugee camps, all of these lead to outbreak of infectious diseases. And then, of course, maternal and child health decline, because you see there is a rise in mortality rates due to lack of prenatal care and delivery services. Mental health as well, trauma, post-traumatic stress disorder, lack of psychosocial support, all of that happen. And then how about vulnerable populations? Women, children, disabled people are even more affected. Now, how do we deal with these problems in times of conflict? The book of Esther says, who knows if it were not for such a time that God has put you to be where you are. And I think we are in times of crisis, God has called us to be to respond and to be there for the people who are in need. I think the first thing, according to safeguarding health in conflict coalition, is to give protection to health workers, protection to services, and protection to infrastructure. And this is through raising awareness of the problem of attacks on health workers, facility, transport systems, and clients, but also work with national and global organizations to strengthen the documentation of such attacks and empower local groups to play a safe, active role in documenting attacks against healthcare workers. This picture on your right-hand side is one of the hospitals, MSF hospitals here in South Sudan that was bombed during the crisis up north in Pangak town. So, and this is exactly what we don't want to happen. So, health facilities, healthcare workers, services, and infrastructure should be protected during conflict. Secondly, we should not wait for good times because we don't know when good times will come. The Bible says, rescue those being led away to death. Hold back those staggering towards slaughter. So we are asked to act quickly whenever there are crises. And if we act on time and quickly, we will rescue and we will save lives. And then thirdly, my own experience is that we need to be leaders and we need to provide direction. Sometimes we say we are paralyzed, we are on wheelchair, but I like this one, paralyzed but can think, on wheelchair but commander-in-chief. So even in times of crisis, we can still think, we can still act, we can still move, and we can still do something. So we need to weigh, we need to analyze the situation and change strategies as necessary. And then thirdly, we need to identify people with integrity, people with skill, people with courage, and people who are brave, to work with them. Ezra was able to identify Sherebia, a man who is a capable man. And Nehemiah identified Hanani, his brother, was a man of integrity. So in times of crisis, these are the type of people we need to identify and work with them. And then, of course, and I think this is also important, we need to build partnerships, collaboration, and coordination with health and humanitarian partners. Uh, Back then, when I was working with NGOs, these are some of the partners that we work with. How do we collaborate with them? Sometimes it's commodities delivery. Uh, Sometimes people, organizations in one zone, they can hire a small flight, deliver commodities, 3 months commodities to one zone that will take those facilities for a number of months. So commodities delivery, we can collaborate, data collection, like one organization would come to a facility or go to facilities we are supporting, collect data for us. If we can come there, we can also do the same for them. Accommodation facilities, there are organizations that have accommodation facilities like their staff guest house. They can also provide accommodation for staff coming to field work. And then information sharing, especially road security, people can always share information. We used to attend meetings where all these partners come together and share security information about road. Are the roads safe? Can we travel safely to where we want to go? And if the roads are risky, it's always an advisory that this is not the right time to travel. So we can partner as humanitarian organizations in times of crisis. And also, of course, we do advocacy as it is for the coalition to protect healthcare services and healthcare providers that I just mentioned. And then we need to provide training. Maybe we can provide formal training. This is the school that was started by ICMDA back here in South Sudan. You can see the Anil there. And we absorbed these students, and then we were not able to get them to classroom because the war started and the hospital in Bor was vandalized. So what we did was we moved them to Uganda. This was the education service. And then we moved them to Uganda to Mengo Hospital. And we graduated like 2 batches there. So we can provide training qualified health cadres is really important in times of crisis because they will come and meet the gap. We can also provide in-service training. This is my in-service training to my staff when I was working for one of the NGOs here in South Sudan. Finally, we can also mobilize resources, express needs, and discern needs. So whenever we can mobilize those resources. But of course, we need also to be creative in times of crisis. Like during the COVID time, somebody helped us make hand washing stations just from local material, as you can see. For organizations, as I conclude, for organizations, each organization should always have emergency response operation manual. And I remember we had one, what to do during times of crisis. So you will find a detailed description of what to do whenever there are crises, whenever there's conflict, whenever there's civil war. That manual will help you. Let me just run through a few of the things. The first one is preparation. As organizations, we always need to be prepared in time, even before a crisis comes. So we need to do proper planning, risk and resource mapping, development of plans and procedures, training and exercising. All of this need to happen before any crisis happen. And then, of course, we need to be prepared to provide response. All activities related to investigation, response, and recovery, we need to do that during crisis. And this should be all spelled out and detailed in the response manual. And then there are actually 4 levels of response. Number one is level 1 is watch. So in watch, we need to constantly monitor and triage information on events, collection, organization, analysis, and dissemination of information. And then the second level is alert. We need to monitor the early warning systems, the early warning signs. So we need to be on standby to see if there's any incident reported, if there's any imminent risk coming, And then we need to conduct intensive monitoring of an incident or event in preparation for a potential incident. And then we need to alert staff. So we have to do intensified surveillance, coordination with other sectors, initiation of preparation for deployment of financial and logistic resources. So we need to keep watch, we need to be alert, and then we need to respond whenever the incident has happened. And then after that, when the incident is over, we need to do review to see how well we have responded. And if there are things that we have not done well, we can now say next time we do better. So we need to identify lessons, develop practical, actionable steps for improving existing preparedness and response systems. We need to share lessons learned from the review with other professionals and organizations. And then, of course, we need to revise and update our organization's emergency operation manual. We look forward to a time where living now in difficult times, but this is what the Bible is saying. God will judge between nations and will settle disputes for many peoples. They will beat their swords into plowshares and their spears into pruning hooks. Nation will not take up sword against nation, nor will they train for war anymore. We look forward to that time, but for now, we need to be alert and provide services whenever we can. We are living in these turbulent times, just for now. Thank you, Dr. Peter. Over to you now. Thank you. Thank you all.
Yeah, thank you so much for that. What an amazing overview. And just you're speaking from deep personal experience, particularly with lots of examples from Sudan, but also just love the way that you brought the scriptures to bear on so many of these contemporary problems as well. So we've got a time for question and answer now. So first question, Dr. Alex, from John Rennie, who you know in the UK, and John says, brilliant review of the effect of wars. Do you think that all medical resources should be focused on public health during wars, while surgery, obstetrics and gynecology and so on is mothballed, or does it need to be a much more comprehensive response in the light of the challenges and reduced resources?
Yeah, indeed. I did mention that in times of war, women and children, older people are really are the most vulnerable people in times of conflict. So, of course, usually in times of conflict, hospitals need to be equipped better to be able to provide services to women, especially pregnant women and the children and the old. So that is the advocacy that people always do. But of course, in civil war, sometimes things happen all of a sudden and hospitals run out of drugs, healthcare migration, with vacuum left behind. So those are real challenges. So in theory, we can say that in conflict, let us provide services to the most vulnerable, women, pregnant women, children, and the old. But I have witnessed that sometimes it is not really practical. But whenever possible, and it is in our means, let us do that. And I also mentioned that we coordinate with other partners where we deliver drugs and essential drugs facilities that can last for 3, 4, 6 months, so that there is no stock out of any of those essential drugs. I also talk of training, that during conflict, we need to provide training like the mid-level health cadres training that we have been providing. It is to bridge the gap so that those people and those in need can find services in the hands of qualified people.
Thank you. There's an anonymous question here. With the withdrawal of the USA, from international organizations like WHO and the closure of USAID. What have you observed? Have you observed greater involvement in healthcare provision and humanitarian relief from other national actors, perhaps like China? And what else is filling the gap? And what is the attitude of Africans towards this change?
Yeah, with USAID withdrawing now, there's of course a huge budget deficit because well, a huge chunk of the health service delivery budget used to come from USAID. But now with that stopping, I have seen there's a lot of budget gap now in healthcare service delivery in many countries here in Africa. But I think it is also a wake-up call for nations to step up to start providing health services to their people. The Arusha Declaration that I mentioned in the beginning says each country should at least allocate 15% of its budget to meet its health needs. But what we have seen now is that only a small percentage is allocated to health in many countries. So I think it is also a wake-up call for countries to start providing a better budget to meet the needs of their people. Other countries and other nations and other organizations, of course, are stepping in to provide services, but it may take time before things pick up. I think there are also church-based facilities that are also trying to meet the needs. But again, that is a drop in the ocean. And so we are grateful to churches and church-based facilities and church-based hospitals that are providing quality services in times of crisis. I work for St. Vincent de Paul Society in Khartoum. We used to have a medical health center there, and it was during those difficult times, it was providing good services to the population around. So I think yes, the church, Mother Teresa has said that what we do is a drop in the ocean, but if you don't do anything, the ocean would be less by a drop. So I think we can't say that we stop providing services because it is just it doesn't contribute much, but that little services is still appreciated and is still needed by the people. Yeah, so I think that's what I can say.
Thank you. The question, a longer question. Your quote from Hosea was very searching. Traditionally, hospitals and healthcare facilities and healthcare workers, including army medics, could expect some respect and protection in areas of conflict. I have the impression that this is no longer the case, perhaps even the exact opposite. Vandalism of abandoned healthcare facilities and specific total war targeting of healthcare workers and hospitals. For example, in Gaza, maybe as a result of being used as a shelter by terrorist organizations, is very common now. Do you have any views as to why this seemingly basic human principle seems to have been lost? And I wonder if, Alex, you could comment specifically on the Sudan situation, which you've described in some detail, that the civil war that much of the world have forgotten. Were hospitals and healthcare facilities and healthcare workers deliberately targeted there? And if so, why does the principle of protecting them seem to have been lost?
Yeah, when civil war breaks out, it doesn't discriminate between health facilities, places of worship, or government infrastructure. You see everything destroyed, and that's the case. That's the case in Khartoum, for example. In Khartoum, Sudan, we see hospitals destroyed. We see health facilities, we see research centers like the one I mentioned. We see even places of worship like churches are also destroyed. So how much of that is known to the outside world? How much of that is reported? I don't know, because there are times when there's not even access to reporting by journalists. So those things happen, and even I showed you hospitals in Syria, bridges destroyed in Russia-Ukrainian war, hospitals destroyed here in South Sudan. All of those happen whenever when there's civil war, and those are very clear examples.
I guess we much of us, or many of us, are not really aware of everything that is going on. Of course, the Gaza war and the Ukraine war in particular have had a huge amount of publicity in the mainstream media, especially Gaza in recent months. And your first slide there was really quite chilling. You showed a picture of North and Sub-Saharan Africa, and it seemed that just about every country was involved in civil war, and yet we hear so little about it. I was particularly struck by the statistics you gave from Sudan, the Sudan war, where there have been 150,000 civilians killed, and shockingly, 45,000 children have died of malnutrition or associated diseases. And I think most of the world is just not even aware of what's happening in Sudan. How do you think that we as Christians could play a better role in making people aware of these events and the needs that they produce?
I did hear the 150,000 people were killed during the Sudan war, and the thousands of children were dying of malnutrition and diseases. So I think, yes, I think it is important that the world knows about this, so that if something can be done to stop the war, I think the most important thing is always to stop the war, because it is devastating. Yeah, so advocacy to stop the war is the most important thing. Of course, there are humanitarian organizations that are trying to come in with drugs and medicines to salvage the situation and to help the needy. But I think the most important thing is to stop the war, because once the war stops, people will stop dying. Yeah. So,
absolutely. And there's been, of course, we all know the history of the political negotiations over Gaza and Ukraine. I wonder, from your experience of Africa and the many civil wars that have taken place there over the last 10 years or so, have you seen any real successes in terms of diplomatic events or negotiation to stop wars happening and then therefore reducing the destruction?
Yeah, well, here in Africa, I have shown a map with many countries in conflict, but usually wars could stop for a short time and then they flare up again. But at least I can say that the war in the Oromia region of Ethiopia, is now relatively calm and peaceful, and we hope that will hold on, and it will be a long-lasting peace. So that's one example. The other countries, the DRC situation for now, we have seen regional blocs like IGAD and Africa Union and world presidents are trying to come in and resolve that and bring lasting peace to DRC. And the situation here in South Sudan is still fragile. In 2018, 2015, there was a peace deal reached, and then that broke down. But again, in 2018, they reached another peace deal, which is still fragile. So to this moment, things are still fragile. So maybe a lot of prayers are still needed to bring a long-lasting peace in these countries that are still in turmoil.
Alex, we've almost run out of time, but I just wanted to ask you one last question from Zimnan Gimba, who you know well. Says, many thanks, Alex, always a blessing. What would you describe as your own motivation to stay behind when all around is war and destruction, famine and disease? So you showed that picture of people, refugees fleeing, and they were relatively well dressed. They had nice suitcases and things on wheels, and you said among them were some healthcare professionals. And it's all perfectly understandable, of course. Most of us have never been in this situation. But for you personally, what was your motivation to stay behind, and what was perhaps you could just talk us a bit through your thought process, and maybe even discussion with the Lord about it as well. What was your motivation?
My motivation was my patients. The people we are serving. I just decided that I should remain behind. We were implementing an HIV project, and for HIV people, when they default, they go into other problems, opportunistic infections like TB, pneumocystic cardiac, and other problems happen to them. So when the crisis happened, I decided that our clients and our patients should not default from their treatment. So that is the decision that I made, and I remember I remained there for months alone with only a few facility-based staff. So I would go from one facility delivering drugs, good enough. We had enough stock, and I would put them all all the drivers were not around. I was using my own vehicle. My boss mentioned in her letter, so I would come with my vehicle, put the drugs and drive them around, distribute them to facilities. And I encourage the facility-based staff that this is temporary. Let us continue providing services to our people. This will pass. So we continued until things calm down. For me personally, as to why I have remained in South Sudan, in spite of all the civil wars, I was born in civil war, grew up in civil war, still living and serving in circumstances of civil war. There was a time I want to leave the country, but the Lord called me to remain behind. And the scripture that God used to talk to my heart was Zechariah 11:17. And in that scripture says, "Woe to the worthless shepherd who leave the flock." So God was saying, if you flee, find your comfort zone somewhere, and you leave your people behind, you are a worthless shepherd. So God gave me the grace to submit, and here I am. I'm still here in South Sudan, and I don't have plans to leave for now, unless God has other plans in the future. So that is why. So for the crisis in 2013, the reason I remained behind was the patients and the people we were serving, and why I have remained in South Sudan and in Sudan is because God has called me to be home and not to go away, because He wants me to be around and serve my people. So,
well, thank you so much, and not just for an incredibly comprehensive and masterly overview of the subject, but for your own personal example as well. And I know that these lessons have been learned not just as a result of much study and thought, but also through learning right at the coalface, right at the front line, and knowing God's provision and grace to you in that situation. So we're incredibly grateful. And in the meantime, may the Lord bless you and yours, and we'll see you again soon.